a neglected tropical disease caused by the protozoan Trypanosoma cruzi that disproportionately affects underdeserved populations, resulting in considerable health and social and economic burdens. The disease is primarily transmitted to people by infected tetratomine bugs, also known as kissing bugs. However, transmissions also occurs through contaminated food, blood transfusions, congenital transmissions, breastfeeding, and organ transplantation. It progresses through an acute phase, which is usually mild and non-specific symptoms, to a chronic phase, which can occur decades after the initial infection. This study was needed because accurate estimates of Chagas disease mortality and morbidity have been historically hindered by underreporting and misclassification, and the lack of reliable data, often with Chagas disease-related deaths being misclassified and as non-specific causes, obscures the actual burden of the disease and complicated effective policymaking globally. Therefore, comprehensive and updated estimates were needed to improve global assessments of the disease. These figures compares global dialysis rate by age for 1990 and 2023, detailing the burden composition. It shows that the years of life lost contributed to a great proportion of the dialysis across most age groups in both years. And in regards to YLDs, chronic digestive disorders were the main cause of YLDs for individuals younger than 65 years old, while heart failure was the main cause for individuals older than 65. The overall global burden of Chagas disease has declined over the past 3 decades. We estimated that there were 10.5 million people living with Chagas disease in 2023. This represents a 16% decrease since 1990 and a 55% drop in the global age standardized prevalence rate. These figures present 2 maps comparing age standardized dialysis rate per 100,000 with Chagas disease globally for 1990 on the left panel and 2023 on the right. And we can see that significant reduction in dialysis burden across endemic areas since 1990. Despite the decline in prevalence in endemic locations, in non-endemic locations, the number of prevalent cases increased by almost 50% from 1990 to 2023. In this figure, we can see the global and regional trends in Chagas disease from 1990 to 2023 by comparing prevalence counts and age standardized prevalence rates. The plots illustrate the consistent global decrease in age standardized rate across endemic regions, while showing the large but changing contribution of different Latin America regions to the overall case counts. The Chagas disease now affects older populations, 45 to 65 years old, signaling future challenge for health systems managing chronic cardiac and digestive complications. In this figure, it compares the age distribution of Chagas disease prevalent cases globally between 1990 in the red bars and 2023 in the blue bars. And we can see the shift toward older ages comparing 1999 to 2023. And in 1999, the peak prevalence was among those aged between 30 to 45 years old. But by 2023, the peak shifted to individuals aged between 45 to 64 years old. To combat Chagas disease moving forward, strategies should prioritize 3 main areas: improving data, reinforcing public health policies, and preparing health systems. First, accurate estimates require continuous refinement of data sources, focusing not just on quality and completeness of the data, but also on proper coding and classification. And this is essential for informing effective health and social policies. Second, in endemic countries, policies focus on socioeconomic development, including better housing conditions and vector control, must be reinforced. And for non-endemic locations, public health systems must implement policies to ensure accessible screening and treatment for immigrant populations, and raise awareness among healthcare providers. And finally, given the shift in the age distribution of cases, health systems must be prepared and funded for caring for older populations living with advanced chronic sequelae such as heart failure.